The coronavirus pandemic struck developing economies at a time when they had already been struggling with unsustainable debt burdens for many years. Due to deteriorating fiscal positions and heightened public debt vulnerabilities, Sub-Saharan African governments are struggling to find room to deploy fiscal policy to address the COVID-19 crisis. Research reports that developing countries now face a wall of debt service repayments throughout the 2020s. Malawi, amongst other developing economies, is not exempted. As the financial turmoil from the global crisis continues, the country has experienced sharp currency devaluations, making debt servicing more strenuous. Join various civil society organizations from Malawi as they give their voices on the impacts of COVID-19 on the debt sustainability in Africa and Malawi in particular.
Well, just like in all other countries that are affected by COVID-19, the economic impact has been very visible, negatively so. As you know that our economy has been stable in the recent past. We've managed to achieve the macro and microeconomic fundamentals. They've been working perfectly well. Our currency has been very stable against, the dollar. Our exchange rate has been very stable at a very low and minimal, place. We have had the inflation at single digit. These are fundamentals that have been working perfectly before COVID-19. Challenges notwithstanding, but with the coming in of the pandemic, you have seen that our economy has really sunk. We are actually struggling to collect revenue because, as you know, that Malawi, we largely depend on revenue collection, of course, as well as the agriculture, agriculture side of it. But largely, we do depend on revenue collection to feed into our national budget. So that has dropped. As a matter of fact, I think it has dropped down to 40% in the recent past. We've had to prioritize in terms of spending. Some projects have had to be stopped, or rather be put on a lower scale in order to concentrate on certain priority areas, like, for example, paying of civil servants, buying and procuring of essential commodities like drugs and all other essential commodities. So indeed, our economy has come down. There are so many companies now that have literally, stopped or closed. Others have downsized. Others are operating at maybe at 50%. So all these factors have had to do with the coming in of COVID-19. That is why I am saying that indeed we are faced, just like any other country that is faced with coronavirus, we are also finding it difficult to make our ends meet with insofar as our economy is concerned.
Yeah, that's another area that I think all the nations are looking at, especially from the third world countries. They are highly indebted prior to the COVID-19. Now they have to mobilize resources to contain the pandemic. It's almost a nightmare for the same highly indebted nations to be honoring their debt obligations. I think there has been an outcry that where necessary we should be talking of giving a relief to these countries so that they are able to contain the COVID-19. Just to give you a scenario how the developed countries from the West have pumped into their system billions and billions of, not kwajas, we're talking of dollars, to contain the situation, especially onto giving a boost or a support to the businesses. Little have we heard about governments giving relief to their businesses. We are talking of businesses that are struggling, but the government is failing to give them the relief. Even in our education sector, we have so many institutions that are offering private education at all levels, primary, secondary, tertiary. These institutions are struggling. In fact, I forgot also to mention this as one of the major industries that have been hit very hard, the education sector. No school fees, and yet the institutions have to pay the teachers. How would you sustain such a situation? Government up to date has not come up with any means of alleviating the situation. Why? Because we have limited resources. And indeed, if the government was to take some billions or trillions out of the purse to support the education system or any other industry that has been affected, that will suffocate the whole financing or the whole funding, and the honoring of the debt obligations would be almost impossible. But it's just our understanding that maybe the World Bank, IMF, and other donors like the African Development Bank can come up with means of mitigating the debt obligations in terms of extending the credit facilities or limiting or even writing off some of the debt amounts. According to my own assessment, I see Africa more responsive than the other Western countries. I think we acted faster than the other Western countries. Of course, with limited resources, we are managing to contain the situation. That's why, up to date, we have not heard of any serious cases in Africa, apart from maybe South Africa, because South Africa is a more open society than the rest of the continent. That's my general assessment, that we have taken advantage of our closeness to contain the virus. But we have to keep on being as vigilant in that kind of a battle. As I said, there is so much uncertainty. So we cannot just sit down and relax and think that all things are okay. We wouldn't even know what would happen in 6 months or 1 year from now. In our case, we may be shocked that it can come back, the pandemic can come in such huge magnitude, rendering us even helpless in the process. But all in all, I think the leadership in Africa have tried to contain the virus in the fastest way, putting all the prerequisite measures so that the pandemic is contained. We have had how many deaths now? Is it only 4?
Only 4.
Up to date, it's only 4. And we haven't heard even the relations that the death looks like the COVID-19. So that tells a story. Yeah.
Maybe what's the story?
That we are containing, we're trying to contain the situation, but taking advantage of our closeness of the society.
Yeah. But we have also witnessed that Malawians are ignoring some of the preventive measures which government set aside, like the social distancing, the gathering of more than 100.
Yes.
Maybe why is it like that here in Malawi?
Yeah, I think I don't want to think on behalf of the enforcers, but it's a general societal problem It's a general cultural problem premised on our Africanness. It's not as easy to enforce the social distancing within the African context. Like when you have a funeral and you say only 50 people should attend. And I've been attending funerals myself to see that there are thousands and thousands of them coming. And I don't think there will be any policeman who can come and say, there are too many of you, disperse, otherwise we're going to arrest you. It will not be representative of our social cultural framework. That's a problem. And the wedding ceremonies, the bridal showers, and so many gatherings, to make it even worse. Now we are within the fresh presidential election campaign, and I don't have to tell you how many people attend such rallies, including rallies organized by the ruling parties, TPP, UDF, the partnership, and even the opposition, the Trans Alliance. They are attracting huge crowds where social distancing doesn't exist. So that's a nightmare. And such kind of a scenario is going to continue, like for the political gatherings. Be assured that it's going to continue up to the time we say we have done the voting. I can't see any law enforcers going to such gatherings, saying, no, government said A, B, C, D, and you should not do X, Y, Z. It's almost impossible. So two issues are coming out completely very clear. One is the generic social cultural framework that we are in. It's almost difficult, if not impossible, to do the social distancing. But this is exacerbated by the political atmosphere that we are in, and rendering the whole enforcement impossible on the social distancing.
Maybe lastly, what's your final comment on the COVID-19 and the response in Malawi?
I take the pandemic as very real, and being a real situation demands that we have to behave cautiously. I'm very cautious myself as an individual when I'm interacting with my fellow citizens. Some elements of social distancing are adopted by myself. I think even the use of the hand sanitizers, hand washing, and all those elements must be upheld. Otherwise, as I said, we don't even know what will happen next time. If we relax, what will happen 2, 3, 4, 5 months from now? That is to say that as much as our socio-economic framework has been shaken to the fullest, we should be cautious on how we want to open the gates again, because there's been some talk on opening schools, primary, secondary, universities, colleges, on opening some businesses. I don't know whether the transportation will be one of the beneficiaries of the opening, but we have to do that cautiously, taking on board some preventive measures that the government and the presidential team came up with. If we want to open the schools, what would be the measures? Are we going to have the face masks or the hand sanitizer? Are we going to afford the hand washing daily? Can I just open the schools we need? Otherwise, we would be putting our citizens at risk. That's my take.
Thank you very much, Professor.
Thank you. You're welcome. Thank you. Basically, as I said already, we've been hit very hard, especially on our businesses. There are so many industries that have been affected negatively, and obviously that would be my first priority to bail them out. And it's not a strange priority anyway, because the other countries, other nations are doing the same. And more especially, as I hinted, that our economy is based on the informal sector. So the informal sector should not be neglected at all. We should not focus only on the huge private sectors, but the informal sector should also be built out. Small and medium enterprises are struggling. Others have completely closed down because of the same pandemic, and that will be my priority as well. Apart from the also targeting of the private schools that have been directly affected. They are not collecting any fees from the students, but still they have to pay their wages and the other overheads. Still, that would be my priority. And in fact, the government promised a bailout package, which was like a very small one, about 35,000 kwacha per month, but it seems nothing has taken off the ground. But these are the areas that should be prioritized in terms of targeting. Otherwise, we're going to lose the whole future as far as Malawi is concerned.
Would you say that probably the coming in of the fresh elections have kind of messed up reasoning and when it comes to prioritizing on how best we deal with this COVID-19?
There should be a separation of activities here. I mean, the political framework and the government, yeah, though related there, but they're not supposed to be operating in like manner. Government is government. They should not lose focus on what they promise, especially when it comes to bailing out our businesses. Let the politicians do their own politics, and let the government do also its own mandate in servicing the public. There shouldn't be, I think it's high time that we are to run away from these hangovers, the political hangovers, where we don't differentiate between politics and government. Government is very different from politics. So that should be the message that I can send. Let's try as much as possible, because we are all government, let's bail out all the sectors that have been affected. After all, we already have that kind of funding, huge funding, to do such kind of an assignment.
Other quarters are insinuating that probably Malawi could have done better in terms of responding to this COVID-19 pandemic, in the sense that it came about three months later after it was first discovered in Wuhan and in China. Would you agree to such sentiments?
I would agree that our reaction, especially on the closure of borders, was rather very late. Not too late, but very late. We would have done better than that in ensuring that the borders are closed in good time. But all the same, we have tried to manage the situation. It's not as bad as would be the case if the borders were still open up to date.
When we had the very first cases in the country, the country was kind of gripped with fear. Nowadays, we have got about close to 500 cases and 4 deaths, with others still recovering from it. But it seems the fear is kind of evaporating from the minds of the people. How do you allude to this? What can be your best explanation?
Yeah, that's the same aspect of the social cultural framework. Our society is premised on other cultural aspects that would be very difficult to dispense with, like the social distancing. Still, people are still gathering. Still, people are still meeting, and that is a very difficult situation for even the enforcers to pursue it. So it's a big challenge. But also the political interventions that we are experiencing at the moment. The politicians are busy doing their campaigns, and the social distancing is not there. Maybe until we do the voting, then you would be talking of something else.
Would we say that the people out there believe, actually take government to its word that the COVID-19 is real, or there's that lack of trust between the public masses and on the other side, government officials?
How do you believe that the COVID-19 is as lethal when the leaders are in the forefront doing the opposite of the government declaration? And some of the politicians that are on the podiums are the same people who are also in government preaching the same, but they are not practicing it. So the other social element is that when leaders do something, the followers tend to take it as a gospel truth. So this kind of breakage on the social distancing has come about because of the leaders that we have around. At least the religious groupings have tried to adhere to the government prescriptions, but the political leaders, we have a problem.
Okay, one must look at the debt sustainability at two levels. There is the external debt, money we owe people from outside, and then there is the domestic debt. So both aspects of debt have been actually severely compromised by the COVID-19. First of all, let's talk about external debt. External debt service, you do that from what your export capacity. Export capacity minus what you need to import as your inputs. So we note that Malawi is a highly import-dependent economy. We're talking about upward of 2/3 of the value of what we produce consists of imported inputs. So we need to pay for those inputs. So apart from that, we need also to service our external debt, which we incurred on account of, say, development projects. So that's one aspect. That's the international aspect of debt sustainability. So COVID-19, to the extent that it has hurt the country's production capacity, we're talking about the demand for imports. Demand for products made in Malawi has been severely actually hampered to the extent that upstream, that's where the producers and then where we import, they are also constrained. They cannot expand production as they would want. This is why other developed countries, market economies, US and so on, there's this stimulus comes in to ease the demand conditions. If people are in lockdown, the demand for lots of products is affected, negatively affected. So that's the external part. Now coming to the domestic part, that too has been impacted in the sense that we're talking about deficit financing for Malawi, the fiscals, government revenues and expenditures, that has been actually severely also affected by the slowdown in the economy. So that part of both parts of sustainability are impacted.
Development partners, including countries and business people, have pledged financial and non-financial support to countries in the fight against COVID-19. How will this be used to alleviate the impact of the pandemic?
Okay, let's look at it this way. The development partners, Malawi's development partners, are also budget constrained. Everybody is under. U.S. economy is budget constrained, and so on. Development partners, they also have worked towards budgets. This pandemic has come as a shock. Nobody was warned about it in advance, so nobody planned for it. So even the inflows from the international development partners into countries like Malawi will not be enough to address Malawi's requirements. So we cannot actually bank on them because they are also severely constrained themselves. Okay, so we cannot say that we will have enough reliance on that side of alleviation of resources wise. So we don't have enough. We should not expect enough. So how the funds will be used? Some of them it's conditional. They tell you that they are going to target, in this case, the health sector. So you may not have leeway to deviate from what the donors want you to spend the money on. Of course, there are cases of slippages. We know that's happening everywhere. Slippages, people can divert resources from where they are intended to other uses.
So what else needs to be done to ease the debt burden?
The debt burden is, that's why you have all these economies very anxious. Brazil, US, China, Italy, they are anxious to get back to some sort of normal. They are calling it the new normal. They are saying that they want to get out of lockdown in order to push the economies into higher gear. So that's what we need to be aiming for right now, to moderate further negative health effects of COVID-19, so that we have breathing space for the economy to get back towards normal.
What is your assessment of government COVID-19 homegrown economic as well as financial stimulus packages?
Let me just put it in context. In the US, there's debate. It's contended, actually. Some people are saying, let's push in $3 trillion. Okay? So other people are saying, no, we should not put in that much. Others are saying that it should even be more than $3 trillion. So for Malawi, our capacity has already been constrained, is limited for that kind of stimulus. Fiscal stimulus is very limited. We've been talking about fiscal deficits in Malawi, which have been there for some time immemorial. So we don't have too much space, breathing space for the government to stimulate positively the economy in that kind of sense. People have been suggesting that, one way, if it's not direct pumping in money to, say, micro, small enterprises, that kind of stuff, why can't you do it through tax relief? So an observation can be made that the Malawi economy, we're talking about it has what is called what we call the missing middle. You have micro, very tiny enterprises, small enterprises, and then you have a missing middle. Okay, small, medium enterprises. That medium is missing in Malawi. So that kind of tax stimulus, where we're saying that government can sort of moderate pressure on micro, small enterprises. So an argument can be put that some of these enterprises do not pay taxes anyway. So any kind of stimulus, fiscal stimulus, which comes by way of tax incentives, will not help them. So it's a big chunk of the economy of Malawi. Okay, so informal sector, you can't stimulate them via that route.
Well, in terms of stimulus, several fundings several funding options have been made available to the industries. For instance, DFID offered a stimulus package, a funding which businesses were requested especially in the agricultural value chain, to actually apply to get a grant that can help them during this coronavirus period. And similarly, also government is also pushing forward requests for industries that require bailouts to actually they have actually now, of course, we have requested that from government on behalf of private sector, and government has actually responded positively by actually requesting us to provide them lists of names and lists of businesses that are actually needing bailout and the reasons why they feel that the bailout is required for them. There have been several other initiatives that have been done. I think where we are looking at, especially when we are looking at issues of lockdown, the lockdown that has been pending for some time for Malawi. In those instances, we were actually able to drive and push government to say, yes, lockdown is happening, but we have some industries that are essential, and we need these to be continuously to continue operating, whatever the case. And for majority of those, we were able to actually get approval from government, and we submitted the names and lists of those industries that were meant to continue operating, and they have obviously continued operating despite the issues of where we are looking of huge gatherings, huge groups of people not being in one place. Here we're looking mostly at manufacturing industry in Malawi, those that have services that are more related to the fight against coronavirus, and those that are actually looking at the food industries, necessities that people cannot do without. Yes.
What is your assessment of government's intervention?
Well, we have seen that in the areas that were...
Yeah, you can attend to that.
Yes. What left? What was it? Is it urgent? Okay. All right. Thanks.
No, it's okay.
Yeah. So I think we have seen that quite a lot of areas where we have been lobbying on behalf of industry, on behalf of the private sector. We have had quite some positive feedback from government. A lot of areas, I think, things that we have seen being implemented. Yeah. So I can take that again.
Yes, please.
Yeah. So we have seen a lot of areas of things that have been impacted, that have been implemented by government, and yet, of course, still other areas where I think where I think the working relationship with government and private sector has also been taken in consideration. For instance, now we have private sector being represented within the presidential task force and the fight against COVID-19.
Yeah.
These are all, I think, efforts that have been done by the chamber deliberately, by the chamber to push to actually try to assist industry in Malawi to ensure that yes, we have a challenge, COVID is there, but things should not stop, things should still continue to move. So those are some of the areas that I think we have really seen that government has really opened up and tried to be responsive to the push from private sector and the efforts of private sector to assist in the fight of the coronavirus. Yeah.
Yeah, I think it depends on each CSO.
Yeah.
But I think for us, we work with the underprivileged people, so we have been actually assisting them in terms of advocating for better policies, so that I think during the COVID they should also not be left behind. For example, we wrote to the President a letter pleading with him to at least reduce a number of prisoners in Malawi Prison Service, because we are told that I think the fertile ground for COVID is where we have so many people. So we wanted that I think if they can reduce the prison population by half, that is also one of the mitigating factors. Fortunately, the President heard to our call and he actually released some prisoners, though it was not to our expectation. He only released 1,000 plus, 1,008 of course to 2,000 prisoners. So we think we have done what we wanted to do. We have been also conducting awareness campaigns for our other clients like sex workers, because we also deal with sex workers. So we've been conducting awareness campaigns just to give them information regarding the company, and flying some adverts in a number of radio stations targeting prisoners and sex workers. Aside advocating for lobbying government, that I think they should also think of the underprivileged when it comes to social transfer. So this is what we've been doing as a CSO.
There's been talk about the health system in the country not being up to speed in terms of handling COVID cases. I don't know, what's your comment on the general preparation of Malawi's health system?
Yeah, I think we are not prepared. We were not prepared, and we are still not prepared. I think we just rushed to do some of the things, but I think we are not prepared. Sometimes we do things as if we are, it has just caught us, maybe I can say it has just caught us unaware, because we find that I think there are conflicting messages coming from the health officers, and the type of response that they are giving, to me, it leaves a lot to be desired. I will just give you a very good example that they are failing to manage a quarantine center that is supposed to be managed by the health system. And also, they failed to handle the people who came all the way from South Africa. They knew that people were coming, but it took them ages to respond, to the extent that most of them, they went out of the quarantine center where they were, and they're actually infecting people. So it's a laissez-faire type of approach which we have from our health officers.
So if you were to advise government, what would you say?
Yeah, I think we just need to go back to the drawing board. Even the government itself is not serious on whatever they are doing. For example, yesterday you heard that I think there were some people invited by the Minister of Health to go and do a walking interviews. There were a number of people fighting for space, while the same government is telling us that we should not be clamped in the small space. So you can see that I think they are actually giving us conflicting messages, to the extent that they have actually diluted the whole issue of COVID, because people now, they're not afraid of COVID as it used to be. The earlier days people were afraid, but after seeing the politicians going out doing campaigns, and the health personnel, actually even the minister himself doing something to the contrary, people will think that I think these people are not serious. So people, it's like business as usual now. So I think the government should go back to the drawing board and see exactly where they are failing, and maybe also just to mention that I think they should take this initiative, not as a government also. They should involve all players in the country, civil society, NGOs, anyone should be involved. So that's what I can say to the government.
Lastly, what would you tell Malawians?
Yeah, Malawians, just to tell them that we have this pandemic. We have actually seen from some news outlets. Outside Malawi, we have seen people dying. So we should not maybe relax. We should know that I think it will hit us bad. The moment it will hit us bad, it will be bad, especially to our country. We are a poor country, we don't have resources, our health systems are very weak. So if we are hit, then it will be disaster.